Hello, this is Dr. Jason Acevedo. This video today is going to discuss a little bit about radiofrequency ablation of the thyroid. So this is a procedure it's performed for patients with thyroid nodules that are benign, that are over 2 centimeters and are symptomatic or growing, meaning that if the thyroid nodule is causing problems with swallowing, pressure in the neck, things of that nature, or or if it's been noted to be growing on repeat ultrasounds, but still benign, it's a great option that's non-invasive, very patient-friendly compared to the traditional option, which would be a partial thyroidectomy, which would be a surgery and general anesthesia. With the thyroid ablation, it's typically done in the office, typically with light sedation, with a type of anesthetic very similar to what you would receive with, say, like a colonoscopy. So what we would do in the case of getting a thyroid ablation is you would come into my office, start an IV, give you a little bit of light sedation. You would not feel or remember anything. And what I would do is once you're off to sleep, I use an ultrasound to find the nodule. I still do some numbing medications to help prevent any postoperative pain or discomfort. And then I use a small device that goes through the skin directly into the nodule, and it uses radio frequency energy to generate a low amount of heat, which eventually will, much like turning a grape into a raisin, shrink that nodule. The procedure typically takes about 30 minutes. After we're done, you'd be a little groggy, but you can go home, you can eat normally, drink normally. Recovery is pretty quick. Usually the next day, patients are back to their normal activities. There can be some pain, some swelling in the neck, usually pretty mild, managed with non-narcotic medications like Tylenol and Motrin. I tell patients to expect a little bit of bruising in the neck. That's not uncommon. And then slowly over time, what will happen is that nodule will slowly shrink and shrivel away. It's not instantaneous. Some patients notice improvements within a week or two. With some patients, it can take 4 to 6 weeks. And for the nodule to completely shrink can take a matter of months. But we would do periodic ultrasounds in the office afterwards just to ensure that everything went well. As far as complications and risks, very few. It is such a mild sedation, there's very little risk from the anesthesia. As far as the actual procedure itself, like I mentioned, a little bit of pain and swelling is not uncommon. Some bruising in the neck is not uncommon as well. But as far as significant complications, very, very rare. There are nerves in the area that go to your voice box that deal with your vocal cords, so some temporary hoarseness can be an issue. Possible bleeding causing what's called a hematoma or a blood collection in the neck is possible, very rare. In general, it's a very well tolerated, minimally invasive procedure, a great way to treat these benign nodules. So if you'd like to proceed, my surgery coordinator can reach out to you and get everything scheduled, or if you have more questions, reach out to my office. Anyway, have a great rest of your day.